Gynecomastia or increased breast development in boys is a common problem which is often encountered in our clinical practice. A large number of parents whose boys have breast development, especially around the pubertal age group, get really concerned that this may be an indicator of significant hormonal disorder and whether these boys will have a normal development of fertility subsequently or not. A lot of boys who come to us with complaints of gynecomastia or increased breast size do not actually have a gynecomastia. Gynecomastia means an increase in breast gland. Many boys who are obese or fat, because of the increased fat, they feel that the breast size is increased, but actually this is not a true breast development. The usual age of presentation of gynecomastia is around the pubertal age group, somewhere around 12 to 15 years of age. A boy has gynecomastia before the other signs of puberty, or if the gynecomastia starts around 17, 18 years of age, that may be a cause of a significant disorder. To confirm the presence of gynecomastia, we have to carefully examine the boys. We bring our thumb and finger close to the areola region and see if there is a point which is resisting this movement. If it's only fat, we don't expect any resistance, while if there is a true tissue, the breast nodule or the breast tissue, we'll find a resistance. A true breast gland development which is persisting for more than 2 years is a significant cause of concern. So if the breast tissue is same as both boys and girls in that both responds to estrogen and testosterone. So estrogen will increase the size of breast tissue and testosterone will decrease that. So in conditions wherein we have got relative increase in estrogen compared to testosterone, there is an increased breast development. The typical scenario of this happens in puberty. So during puberty, as the testis becomes more functional, the testis and the adrenal are the two glands which are producing testosterone. There is a relatively earlier increase in estrogen levels compared to testosterone levels, resulting in some breast development, which after some time when the testosterone levels really rise up, this is taken care of and the breast tissue becomes normal. Very common during early puberty for boys to have some breast development which will decrease over time. Approximately 20 to 30% boys will have some breast development during early stage of puberty, and in 90% of these cases this breast development will recede over a 2-year period. Obesity is an important associate of gynecomastia or increased breast development. Many boys who are obese come to us with gynecomastia, but they do not have a true gynecomastia in that their breast development is because of fat. Obesity is also associated with increased estrogen levels because fat is the site where estrogen hormone is produced. So obese boys may also have true gynecomastia. The most common cause of gynecomastia in boys is physiological, in that the breast development is more because of the hormonal imbalance which is common during puberty. Gynecomastia may be a representation of a serious underlying hormonal disease. So gynecomastia may be a manifestations of disorders of delayed puberty in boys like Klinefelter syndrome. It may happen as part of many of the disorders in the body like liver disease, kidney disease. The use of many drugs may also cause gynecomastia. So the most important aspect is to really examine the chest, whether there is an actual breast development or the fat development by approximating the thumb and finger in the areola region and finding a resistance. Measuring the size of breast tissue, if the diameter is more than 2 centimeters, it means it's significant, and if the diameter is more than 4 centimeters, we are extremely cautious. All breast developments are not gynecomastia. Rarely there could be a cancerous growth in the breast in males also. The breast development which is happening on only one side of the breast tissue is extremely hard. The skin over the breast tissue is altered. There are associated nodes which are present in the other regions. We are really worried that this is not just a gynecomastia. This may be a serious underlying breast carcinoma which requires an urgent evaluation. The hormonal evaluation of a boy with gynecomastia includes the evaluation of LH, luteinizing hormone, FSH, follicle stimulating hormone, and testosterone levels. We also have to look for other possibilities like thyroid problems, problems in prolactin, problems in the liver, in the kidneys. Gynecomastia usually reverses in most cases in a 2-year period. However, if the breast size is more than 4 cm in diameter, if the gynecomastia is persistent beyond 2 years, we have to worry and think about possible intervention. There are certain medicines which can be used to treat gynecomastia. However, they are required in only less than 5% of cases and we use them very cautiously. These drugs alter either the production of estrogen or the action of. Less than 1% of all boys who have gynecomastia may require surgical intervention. Surgery is more commonly required in boys who have very large breast tissue, in whom there is no improvement in the breast tissue for beyond 2 years, or if there is an underlying disorder like Klinefelter syndrome. In that